So in 2012, there were 9 million infected cases of tuberculosis. Out of those 9 million cases of tuberculosis, 3 million of the cases died. Hi, my name is Ashton Lane, and today for Ms. Boswell's STEM Prep Project presentation, I'll be presenting to you tuberculosis. The objectives today that we'll be talking about are Frederick Chopin, active tuberculosis, the causes, risks, transmission, diagnosis, latent tuberculosis, the treatment, diagnoses, the skin test and blood test, active and latent tuberculosis statistics, and the experiment. Frederick Chopin was a famous composer. He had respiratory issues as a child, and his sister also had tuberculosis. We believe that he got tuberculosis from his sister at a young age, and it showed up when he got older. He died from tuberculosis at the age of 39 in 1849. What is tuberculosis? Mycobacterium is the bacteria that causes tuberculosis, and it's mainly spread through the lungs and the throat, but can also affect other parts of the body, such as the spine and, such as the spine, yeah. Symptoms include a bad cough that'll last usually 3 weeks, pain in the chest, coughing up blood or septum, weakness, and fatigue. Also, other symptoms include weight loss, no appetite, chills, fever, and sweating at night. Risk factors. There is a greater chance of developing tuberculosis if you have HIV infection, if you've had tuberculosis earlier within the past 2 years, diabetes, other health issues, alcoholism, if you have drug issues, and if you had tuberculosis infection or disease and it wasn't treated correctly. How is it transmitted? Tuberculosis is very contagious. We learned that it was contagious from Jean Anton Villemin. He infected guinea pigs and rabbits and put them all together to see what would happen if bacteria would spread, and it did. That's how we learned it was contagious. The way it is transmitted is by coughing, sneezing, or talking. When someone coughs, sneezes, or talks, the bacteria is released into the air, and other people can breathe it in and contract the infection. The diagnosis. Tuberculosis skin test is one of the ways of diagnosing tuberculosis. It was discovered in 1907 by Clemens von Webb. It showed 3 years later, they used it to show latent tuberculosis in children. Then there's the blood test. Instead of using the skin test, you can take a blood test. And they also call it gamma release assay, also known as IGRA. It helps find the tuberculosis germs flowing through your bloodstream. What is latent tuberculosis? Latent tuberculosis is when you have the bacteria in your body, but they are not active. They are just latent in your body. You do not see symptoms, and it is not contagious. You will usually see normal, regular X-rays if you don't have anything wrong, but when you take the blood or the skin test, it will show up positive. That's how you know if you have latent tuberculosis. The treatment. There are drugs that you can take to treat tuberculosis, such as isoniazid, INH, rifampin, RIF, ethambutol, EMB, and pyrazinamide, PZA. You can also do a 2-month therapy and a TB regimen for 4 to 7 months. What are the risks if you were not treated for tuberculosis? Well, 5 to 10% of the tuberculosis infection people will get tuberculosis disease. Within half of the 5 to 10% will get it within the first 2 years of getting the infection, and half will get it later on some other time in their life. Active and latent tuberculosis statistics. Tuberculosis has been killing people for over 5,400 years. They have found tuberculosis in the lungs of even Egyptian mummies. In the early 1800s, 1/3 of all the deaths that occurred were related to tuberculosis, and 1 out of every 7 people died in America and Europe because of tuberculosis. Every year, about 1.4 million deaths occur now. In 2010, 1.5 million related deaths occurred, and they called tuberculosis the leading killer of adults, second to infectious diseases. My experiment. They used the isoniazid to prevent tuberculosis in guinea pigs. Guinea pigs are used a lot for experiment testing because they work kind of like humans, but they usually use guinea pigs to test because they're not very expensive and they need a lot. The hypothesis was that it could prevent tuberculosis in the guinea pigs. The experiment. They used 1,250 guinea pigs, and they isolated them for 3 weeks. Every week, 1% of the guinea pigs would die, leaving at the very end of the 3 weeks, there were only 1,224 guinea pigs left. They were separated into 5 groups, and 2 of the groups were untreated for any result. The treated groups. The treated groups consist amount of water each day, about 0.2 mg, 0.5 mg, and 0.1 mg per milliliter water. 25 mg, 5 mg, and 1 mg per kilogram of body fat was taken out daily. They injected each guinea pig with mycobacterium, which, as I stated earlier, is the bacteria that causes tuberculosis. They realized that the guinea pigs were dying really quickly. By the end of the 10 weeks, 7% of the original amount they had were the only ones living, only 7% were left. After 10 weeks, 5 mg per kg of placebo protected them from tuberculosis, this killer infection that was killing away all of the guinea pigs. This conclusion to the experiment. This little bit of isomate in the water protected the tuberculosis infection and developed a resistance to later untreated infections that might occur later on. These are my citations. Any questions?
Raise your hand if you have a question for Ashley.
Let's see.
You said that when you said the diagnosis was a skin test or a blood test. Can you elaborate more on exactly how they do a skin test?
Well, I couldn't, I believe that what they do is they take a piece of your skin and they go through and look at it under the microscope and try and find the bacteria living in your skin. Ella? Oh, sorry, did I answer your question?
What age range does tuberculosis affect?
It can affect all age ranges, like from babies to adults, young and old. William?
Do you happen to know why tuberculosis is so prevalent in adults?
Question?
Do you happen to know why tuberculosis is so prevalent in adults? Why?
Because usually by the time adults are adults, they have already had other issues and their respiratory system is like not as good or as strong as children's. And so if they get the infection, it is more likely to get the disease than
Thank you.
Jada?
Probably when someone died or gets after tuberculosis, they have that respiratory problem.
Usually within the first 2 years, but if the respiratory system is like not that bad, the medicines they take can help. Does that answer your question?
Yeah.
Maya?
Okay, so they give you a biopsy for a skin test. What would be the blood test?
They take a sample of your blood. And
How much they take?
I'm not really sure. I have to look that up. I'm not sure how much they take, but I know they take a small sample of your blood and they look at it and test it. Okay.
Two of the risk factors for getting tuberculosis were being an alcoholic and being a drug addict. Do you know why those are risk factors?
I believe it's because having too much alcohol in your system is already not good, and too many drugs in your system is not, it's already going to weaken your immune system. And then if you get tuberculosis and you're still doing drugs and you're still drinking a lot, it's just weakening it even more, and so you're more likely to.
So after the first stage, the second stage is just the, what is that stage called again?
Wait, can you repeat the question?
After the first stage of it, the second stage, what is that called?
Well, no, it's not two different stages. There are two different types. So there's latent tuberculosis. Is that what you mean? And active?
Yeah, so with the latent tuberculosis, it's just like sit in your body. That's all.
Yeah, it's pretty much like it just like it doesn't do anything. It's not really active. It's just there. And if you're not treated for it, it can become active throughout your body.
How many cases have been reported to tuberculosis?
There have been, we don't know exactly how many cases there have been actually because it's been around since Egyptian times, but they know that it's been around for many, thousands of years, so they couldn't count the exact number.